What I'm about to show you may completely change the way you think about your blood pressure medicine. Because if you're taking amlodipine, losartan, or lisinopril, there are changes happening inside your body right now that many people dismiss as just getting older, when sometimes it's actually the medication trying to tell you something important. And when I reveal the one reaction that can begin like a minor annoyance but turn into a true emergency, you're going to understand why so many people wait too long, assume too much, and miss the warning signs their body has been sending them all along. I'm Dr. William Elliott, and I need to tell you something that could protect you from a very dangerous mistake. Most people think blood pressure medicine works quietly in the background. They believe you swallow the tablet, the pressure comes down, and that's the end of the story. But that is not what really happens. These medicines don't just lower a number on a machine. They change how your blood vessels behave, how your kidneys respond, how your body handles fluid, and in some people, how their lungs, skin, and even face react to that treatment. And here's what concerns me most. Right now, somewhere, someone is taking one of these medicines, developing a side effect that is absolutely fixable, but they're ignoring it because nobody explained what normal looks like. At the same time, somewhere else, another person is feeling a body change that seems mild, maybe a little swelling, maybe a cough, maybe some dizziness, and they're about to stop their medication on their own without realizing that the sudden decision could send their blood pressure back up and place them in real danger. Both mistakes happen every single day. By the end of this video, you'll know what may happen to your body on amlodipine, losartan, or lisinopril, which changes are common, which ones are drug-specific, and which ones mean you need medical help immediately. But more importantly, you'll understand why one symptom that people often brush off as harmless can be the clue that your medication is right for someone else, but wrong for you. And once you understand that, you'll never look at ankle swelling, a dry cough, or sudden lightheadedness the same way again. Before we begin, please subscribe to this channel for life-saving health guidance that helps you protect your heart every day. Now, before I tell you what may happen with each medication, you need to understand something that changes everything. Amlodipine, losartan, and lisinopril all lower blood pressure, but they do it in different ways. Amlodipine relaxes the muscles in your blood vessel walls. Losartan blocks a hormone signal that tells vessels to tighten. Lisinopril reduces the body's production of that same tightening signal. That sounds simple, but each pathway creates its own pattern of body reactions. And if you don't know that pattern, you can misread a warning sign, or worse, assume the wrong medication is the problem. Let me start with amlodipine, because this is where many people get blindsided. I want you to imagine Patricia, 72 years old, retired, active, doing everything right. Her blood pressure finally came under control after years of stubborn numbers. She was relieved. Her readings looked better. Her doctor was pleased. But 3 weeks later, she noticed that by evening, her socks were leaving deep marks around her ankles. Her shoes felt tighter. Her feet looked puffier than usual. She thought, maybe it's summer heat, maybe too much standing, maybe age. What she didn't realize was that her body was showing one of the most common reactions to amlodipine. This is what amlodipine can do to your body. It can cause swelling, especially in the ankles, feet, and lower legs. And this is where people get confused because they assume swelling always means the kidneys are failing or the heart is shutting down. Sometimes that is true in medicine, but with amlodipine, the swelling often happens for a different reason. The medication opens up certain blood vessels so well that pressure shifts in the tiny capillaries and fluid leaks into the surrounding tissues. So the body looks like it's retaining water, even when the deeper story is more about vessel dynamics than simple fluid overload. Patricia did what many people do. She ignored it for a while. Then she tried to fix it herself by drinking less water. Then she got worried and skipped a few doses. Suddenly, her blood pressure started bouncing back up, and now she had 2 problems instead of 1. The swelling was real, but so was the danger of poorly controlled pressure. Here's the important part. Swelling from amlodipine is common, but that doesn't mean it should be dismissed. If it is mild, your doctor may monitor it, adjust the dose, or pair the drug differently. If it's significant, it may be a sign that this medication is not the best fit for your body. And here's the trap. Some people think if my ankles are swelling, then the medicine must be damaging me. Not necessarily. Some people stay on amlodipine for years and do beautifully. Others simply cannot tolerate that side effect. The mistake is not recognizing the pattern. The mistake is assuming that because swelling is common, it is automatically acceptable. If your legs are getting heavier, tighter, more uncomfortable, or one day you look down and barely recognize your ankles, that is not a symptom to quietly absorb into your routine. That is information your doctor needs because your body may be telling you this medication is lowering pressure, but at too high a comfort cost. Now let me show you what lisinopril may do, because this one is notorious and often misunderstood. I want you to meet Robert, 69 years old, former contractor, practical man, not someone who complains easily. He started lisinopril and felt fine at first. His blood pressure improved. No problem. Then, 2 months later, a cough appeared. Dry, persistent, not a cold, not chest congestion, not mucus, just that constant tickle in the throat that wouldn't leave him alone. He coughed during dinner, coughed while talking, coughed through television shows, coughed in bed at night. And because it came on gradually, he never connected it to the medication. This is one of the most classic things that may happen to your body on lisinopril, a dry cough that does not go away. And I need to be very clear here. Not every cough on lisinopril is dangerous, but it can become miserable. It can rob you of sleep, wear down your patience, and make you think you have allergies, reflux, a lung issue, or a virus that never ends. The reason it happens is fascinating. Lisinopril belongs to a class called ACE inhibitors, and while it lowers blood pressure effectively, it can also lead to a buildup of certain substances that irritate the airways. So the lungs keep reacting, even though there's no infection to fight. Robert tried cough drops. He tried honey. He tried sleeping propped up on pillows. He even changed detergents because he thought maybe something in the house was bothering him. Nothing worked. Why? Because this was not a household problem. It was a medication pattern. And here's what makes this so frustrating. The cough can start days after beginning lisinopril, or it can wait weeks, even months. That delay is why people miss it. They assume if a medicine was the cause, the symptom would have started immediately. But, that is not how lisinopril cough always behaves. Sometimes it sneaks in so slowly that it hides in plain sight. Now here's where I need you to listen carefully, because this distinction matters. A dry, nagging cough from lisinopril is often not an emergency. But facial swelling, tongue swelling, throat tightness, or trouble breathing absolutely can be. We'll get to that in a moment because that reaction is one of the most serious in this entire video. But first, understand the practical lesson. If you're on lisinopril and a dry cough has become part of your daily life, do not let anyone tell you it's all in your head. It may be your medicine. And if it is, there are other options, including medications like Losartan, that often avoid that particular problem. And that brings us to Losartan, because many people are switched to it after lisinopril for exactly that reason. They think, great, no cough, problem solved. Sometimes yes, but Losartan and lisinopril share something that can become much more important than a cough, and that is what they may do to your kidneys and your potassium level. Let me tell you about Elena, 75, who started feeling weak, a little off balance, and unusually tired after a medication adjustment. Her blood pressure readings were not terrible, nothing dramatic, but inside her body, something important had shifted. Her blood tests showed that her kidney function had changed, and her potassium had climbed higher than it should have. This is one of the body reactions people almost never feel coming. Unlike a swollen ankle or a cough, high potassium and kidney changes may stay silent at first. You may feel fine while the lab work moves in the wrong direction. Or you may feel vague symptoms that are easy to blame on aging. Weakness, fatigue, lightheadedness, reduced appetite, maybe an odd sense that your energy has dropped for no clear reason. Losartan and lisinopril can both do this because they change the hormonal system that helps regulate blood pressure, fluid balance, and how the kidneys handle sodium and potassium. That means they don't just affect vessels, they affect the body's chemistry. And this is where fear creates confusion. So let me simplify it. A small shift in kidney numbers after starting one of these medicines is not always a disaster. Sometimes doctors expect mild changes and simply monitor them. What matters is whether the change is appropriate, stable, and safe. But if the kidney function worsens too much or potassium climbs too high, the body can move into dangerous territory. High potassium can affect the heart's electrical system. It can trigger weakness, abnormal rhythms, or symptoms that seem subtle until they become severe. That is why your doctor orders blood tests after starting or changing these medicines. The lab work is not a formality. It's surveillance. Elena's problem turned out not to be the medication alone. She had started taking an over-the-counter pain reliever for back pain, was using a salt substitute because she was trying to be healthier, and had been a little dehydrated after several days of diarrhea. That combination matters. NSAID pain medicines can interfere with how these drugs behave in the kidneys. Potassium-based salt substitutes can push potassium upward. Dehydration can turn an otherwise manageable medication into one your body suddenly struggles to tolerate. So when people say, "I've taken Losartan for years and been fine," they may be right. But if something else changes around the medication, your body's response can change too. This is why one of the most dangerous assumptions in blood pressure treatment is, if I've tolerated it before, I will tolerate it forever. Not always. Your kidneys at 78 are not your kidneys at 68. Your fluid balance during a stomach bug is not your fluid balance on an ordinary Tuesday. The pain medicine you grabbed at the drugstore may matter more than you think. The salt substitute you sprinkled on dinner because you were avoiding sodium may quietly be delivering potassium your body cannot clear efficiently. That is how people end up in emergency departments with abnormal labs they never felt developing. The medicine did not suddenly become evil. The context around it changed. Now let me show you the reaction that all three of these medicines can cause in different ways, and this is the one that makes seniors especially vulnerable to falls. I'm talking about dizziness, lightheadedness, and blood pressure dropping more than your body can comfortably handle. Harold, 81, started a new dose and said something I hear all the time. "I don't feel sick, doctor. I just don't feel steady anymore." He was fine sitting down, but when he got up from bed or rose from a chair, the room seemed to tilt for a second. He grabbed furniture. He paused at the kitchen counter. He started moving more slowly. He thought maybe his balance was going. What was really happening? His body was adjusting to lower pressure, but not gracefully. Amlodipine, Losartan, and Lisinopril can all make you feel dizzy, especially when you first start, when the dose increases, when you stand too quickly, or when you're dehydrated. The blood pressure may be better on paper, but if your brain gets less perfusion for those first few seconds after standing, you feel it immediately. And in an older adult, that feeling is not just annoying, it's dangerous. 1 second of wooziness can lead to a broken hip, a head injury, or the beginning of a fear of walking that slowly steals independence. The symptoms sound small. The consequence can be enormous. This is why I tell my patients never to judge a blood pressure medicine only by the number it produces. A perfect reading is not perfect if you feel like you might collapse every time you stand up. If you're waking at night to use the bathroom and taking those first few steps in the dark while lightheaded, that's not a minor inconvenience. That's a fall risk. And if you add alcohol, hot weather, vigorous sweating, diarrhea, or missed meals, the effect can intensify quickly. The body that tolerated the dose yesterday may not tolerate it the same way today. So yes, lower blood pressure is good. But lower blood pressure without stability is not the goal. Now let's go back to amlodipine, because swelling isn't the only thing it may do to your body. Some people notice flushing, a pounding heartbeat, headache, fatigue, or a strange sense that their heart is more noticeable in the chest. That can be unsettling. I remember a woman named Diane who called in frightened because she said, "My blood pressure medicine is making me aware of my heart." She wasn't having a heart attack. Her tests were fine, but her body was reacting to those widened blood vessels, and as circulation shifted, she felt the pulse more strongly than before. That experience is common enough to recognize, but still important enough to discuss. And here's what makes amlodipine tricky. Because it often works so well, people tolerate symptoms longer than they should. They keep saying, well, my blood pressure is finally under control, so maybe I should just live with the swelling, the flushing, the fatigue. Sometimes that trade-off is reasonable. Sometimes it isn't. That is a decision made with your doctor, not with silent suffering. Also, and this surprises many people, amlodipine can occasionally be associated with gum swelling or tenderness. Not everyone gets it, but when it happens, people think it's a dental problem only. Sometimes the mouth is reflecting the medicine too. Your body doesn't separate systems the way medicine textbooks do. Now we need to talk about the reaction that frightens me most on lisinopril. And yes, it can rarely happen with Losartan too. This is angioedema, sudden swelling of the lips, face, tongue, or throat. And I need to slow down here because if you miss this point, you miss the most urgent part of the video. Let me tell you about Michael, 66. He woke up one morning with his lower lip puffed out. No pain, no rash. He thought, maybe an insect bite, maybe something he ate. By noon, his tongue felt thick. By early afternoon, his speech sounded different. His daughter took one look at him and drove him straight to the emergency room. That was the right decision because angioedema can progress fast, and when it involves the tongue or throat, the airway can become compromised. The terrifying part is how innocent it can look at first. A little swelling, slight fullness, a sensation that your mouth feels strange. People wait because there's no dramatic chest pain, no flashing red light, no obvious alarm. But with lisinopril in particular, swelling of the face, lips, tongue, or throat is not a wait-and-see symptom. It is a medical warning. And once it happens, the medication usually cannot remain part of your treatment plan. The body has already declared that this pathway is not safe for you. This is also why I never want people to treat all side effects equally. A cough is not the same as throat swelling. Ankle edema is not the same as difficulty breathing. Mild dizziness when standing is not the same as fainting on the bathroom floor. Medicine safety depends on recognizing which category you're in. If you're watching this and thinking, I had lip swelling once but it went away, please don't dismiss that history. Even if it's settled, it still matters. Your doctor needs to know. This is how catastrophic events get prevented, not by panic, but by understanding what your body is trying to tell you while there's still time to act. Now, let me tell you something many viewers don't expect to hear in a blood pressure discussion. These medicines can also interact with seasons, illnesses, and routines in ways that make a stable dose suddenly feel unstable. Winter stomach virus? Now you're dehydrated. Summer heat wave? Now you're sweating more. Dental procedure? New prescription? Over-the-counter decongestant? Anti-inflammatory painkiller? Potassium supplement? Salt substitute? All of these can alter how amlodipine, Losartan, or lisinopril behave in your body. And because the medication bottle didn't change, people assume the medicine can't be the issue. But, the body you're asking to process that medicine may have changed overnight. I saw this with Leonard, 79, who had been on lisinopril for years without trouble. Then he developed a bad flu with vomiting and poor fluid intake. He kept taking the same dose, which is usually the right instinct unless a doctor has told you otherwise. But he also kept taking ibuprofen for aches, wasn't eating, and became progressively weaker. By the time he came in, his blood pressure was low and his kidney numbers had worsened. The medicine that had helped him for years was suddenly too much for the context his body was in. This is why medication safety isn't just about the pill. It's about the body conditions surrounding the pill. And there is another reaction people often misread completely: fatigue. Not dramatic exhaustion, just that dragging, heavy, slower than usual feeling. Some people describe it as brain fog. Others say they feel older overnight. They nap more. They lose some drive. They wonder if depression is setting in. Sometimes that has nothing to do with the medicine, but sometimes it does. If blood pressure has dropped more than your system tolerates well, or if a side effect is constantly wearing you down like cough, swelling, poor sleep, or lab imbalance, the result can be a life that looks safe on paper but feels diminished in reality. Good treatment is supposed to protect your life, not shrink it. Now here's a reaction that almost nobody talks about until it happens. Rarely, with amlodipine, People with severe heart disease can develop worse chest discomfort after starting it or after a dose increase. This is uncommon, but it matters. If someone already has significant coronary disease and suddenly develops chest pressure, pain spreading to the arm, jaw, or back, or new shortness of breath after a medication change, that is not something to explain away as adjustment. That needs medical attention. Again, rare does not mean impossible. When people hear that a medicine is common, they stop respecting the uncommon things it can still do. That is how rare side effects get ignored until they become crises. And I need to say something important about pregnancy, even though many of my viewers are older. If a daughter, granddaughter, caregiver, or anyone in your family is taking Lisinopril or Losartan and may become pregnant, these medicines require very serious discussion with a doctor. They are not considered safe in pregnancy. I mention this because health advice travels through families. Many times a senior viewer is the one who notices a medication name in a loved one's purse or hears about a side effect first. So even if this part doesn't apply to you personally, it may help you protect someone you care about from a dangerous oversight. So what should you actually watch for if you're taking one of these medicines? Let me simplify it in the clearest way I can. On amlodipine, watch the ankles, the feet, the legs, the flushing, the fatigue, the headaches, and whether your heartbeat feels suddenly more noticeable. On Losartan, watch dizziness, unusual weakness, stomach upset, swelling, and pay attention to blood tests because the most important changes may not announce themselves loudly. On Lisinopril, watch the cough, the dizziness, the fatigue, the labs, and above all, any swelling of the lips, face, tongue, or throat. Once you know the pattern, the medication stops being mysterious. But there is one more mistake I need to save you from, and it's a big one. People either ignore every symptom or panic over every symptom. Both responses are dangerous. If you minimize everything, you miss the warning. If you catastrophize everything, you end up stopping medication you may actually need. The intelligent middle ground is this: notice the symptom, document the timing, look for patterns, check your blood pressure properly, and tell your doctor exactly what changed and when. Did the swelling start after a dose increase? Did the cough begin 6 weeks after starting Lisinopril? Did the dizziness begin during hot weather? Did weakness show up after using a salt substitute? Those details solve cases. Let me tell you about Sharon, because her story brings everything together. Sharon was 76 and had been placed on blood pressure treatment after several elevated readings. She did what responsible patients do. She took the pills faithfully. But then little changes began. Mild ankle swelling on amlodipine. Then she was switched. Later, a dry cough appeared on Lisinopril. Then she moved to Losartan. Months later, her lab work showed potassium creeping up after she started a heart-healthy seasoning mix that used potassium chloride. At every stage, the body was giving clues. The problem was not that medicine failed. The problem was that nobody had helped her understand the language of those clues. Once she learned it, everything changed. She began tracking symptoms with the same seriousness people use to track blood pressure numbers. She stopped guessing. She stopped blaming age for everything. She stopped changing her routine without mentioning it. And with that, her treatment improved dramatically. She ended up on a regimen that controlled her pressure without the cough, without major swelling, and without dangerous lab changes. That is the goal. Not finding a perfect medicine with zero side effects for all humans, because that medicine does not exist. The goal is finding the medicine your body tolerates well enough to protect you safely over time. That requires attention, not fear. Observation, not denial. Now let me give you the practical checklist I want you to remember. If you take amlodipine and your feet or ankles are swelling more and more, tell your doctor. If you take Lisinopril and you've developed a dry cough that won't leave, tell your doctor. If you take Losartan or Lisinopril and you're feeling unusually weak, dizzy, or unwell, especially after dehydration, a new painkiller, or a change in diet or supplements, tell your doctor and make sure your labs are being followed. And if you take Lisinopril or Losartan and notice swelling of the lips, tongue, face, or throat, or trouble breathing or swallowing, do not wait. That is urgent. Also remember this. Never stop one of these medicines abruptly just because a side effect scared you, unless you are dealing with a true emergency and have been told to stop. The body doesn't like sudden swings. Blood pressure can rebound. Risk can rise. The safer move in most situations is to contact the prescribing clinician and describe exactly what's happening. A medicine can often be adjusted, replaced, or monitored in a smarter way. But when patients make the decision alone in a moment of fear, they often trade one problem for a more dangerous one. Your body deserves a better strategy than panic. And I want to end where we began, because this matters deeply. Amlodipine, Losartan, and Lisinopril have helped millions of people prevent strokes, heart attacks, heart failure, and kidney damage. These are not bad medicines. They are powerful medicines, and powerful medicines deserve respect. If one is right for you, it can extend your life. If one is wrong for you, your body usually gives you clues before catastrophe arrives. The tragedy is not that side effects exist. The tragedy is that so many people were never taught how to recognize them. That's what I wanted to change for you today. So if you're taking amlodipine, losartan, or lisinopril, don't just ask, is my blood pressure lower? Ask, what is my body telling me? Are my ankles bigger? Am I coughing for no reason? Am I dizzy when I stand? Have my labs changed? Do I feel weaker, puffier, foggier, less steady than before? These are not random annoyances. They may be the exact information that helps your doctor protect you better. Listen to those signals. Write them down. Take them seriously. That one habit may be what prevents a fall, an ER visit, a dangerous reaction, or months of suffering you never needed to endure. Share this video with anyone taking blood pressure medicine, because there is a very good chance they're living with a side effect they still haven't connected to the pill bottle on their nightstand. And subscribe to this channel if you want more clear, practical health guidance explained in a way that helps you act before small problems become serious ones. Your medicine should help your body, not confuse you. Your blood pressure treatment should protect your future, not quietly undermine your quality of life. Take care of yourself, pay attention to the signals, and I'll see you in the next video.